session of the download. Today is June 1st, and hopefully it is as beautiful outside wherever you are as it is for me. Hope everyone had a wonderful extended weekend. I'll be your host and facilitator for today. My name is Tracy Webb. I am the outreach manager here at MiHIN, and I'm joined by my co-host Katie, who's going to help be our chat moderator and call out any questions that you have along the way. So just a few things before we go ahead and get started. Today's session will be recorded. All attendees are muted upon entry. However, you can ask any questions or add any comments into the chat box as we go through the presentations today. We've got a full agenda for today. You can locate that chat control center in the bottom right-hand portion of your screen. We'll also hold some time for Q&A, so feel free to unmute yourself at that time and ask any questions that you may not have had a chance to get into the chat. So a little bit about MiHIN in case we have any newcomers today. We are Michigan's initiative to continuously improve healthcare quality, efficiency, and patient safety by promoting secure electronic exchange of health information. We represent a growing network of public and private organizations working to overcome data sharing barriers, reduce costs, and advance the health of Michigan's population. We have 5 key focus areas, which are convening people, championing statewide use cases to get data flowing and keep it moving securely among all parties. We operate as a shared services, as behind the scenes infrastructure. We provide tools to support daily workflows and coordination. And we have reporting, conformance, and analytics from data lakes and our longitudinal health record. For today's agenda, Crystal Schramm is going to give us an overview of the MiGateway conformance module. And Michael Taylor is going to speak to us about Doretto Reg, making compliance easier and free. We've got a large handful of announcements at the end of today's session, and then we'll follow up with some Q&A time. So with that, I'd like to call to the floor Crystal Schramm, who's going to talk about the conformance module. Crystal?
Hello, this is Crystal. Can you hear me okay?
Yeah, we hear you great. Thank you.
Awesome. My name is Crystal Schramm, and thank you for that introduction. I am a product manager here at MiHIN, and I am delighted to talk about the conformance module with you today. Next slide, please. So I'm going to just kind of discuss briefly why conformance is so important and significant and what we're doing with it. And then I'm going to briefly discuss some screenshots from the module for ADP conformance reports and CCDA, and then do some Q&A at the end. But as always, if you have questions, feel free to put them in the chat and we will definitely get to those. Next slide, please. So I really wanted to start this presentation off by talking about the significance of conformance, because I think anytime you have to do something with a report and metrics and you just want to check it off your list, you want to make sure what you're sending is correct. Sometimes I think you can forget the significance of why we do what we're doing. Even from a MiHIN perspective, we're receiving the data and we're sending it to someone else. And that sounds so simple, but it's so much more complex, because what we receive, we want to have the highest data quality standards for what we're sending and receiving. And specifically for conformance, we're talking about admission, discharge, and transfer events, and consolidated clinical document architecture, or CCDAs and ADTs. But in the big picture, the grand scheme of things, none of that matters unless the care that you're delivering at the hospital level is safe and effective, and you're collaborating across different organizations to share the data for the patient care. we know that you're doing an amazing job in the care that you're providing in those events at the hospital, and we know that you know how to document those events. We want to be able to take all the work that you did, take it in, make it be the best data it can be, and then send it to someone else to continue to improve that data care. So I think it's always important to kind of take a step back and remind ourselves why we're doing what we're doing, because you can kind of get stuck in that health data space and you forget that there is a patient down at the end of the road that is really the reason why we do is what we're doing. So those conformance standards are designed to continually improve the data that flows through MiHIN, ensuring it's complete and actionable when it's received by the practitioners using the information on the other end. Next slide, please. So this conformance module, historically MiHIN has done this, manual, getting those requests, sending the reports out to the organizations that are requesting them. Then, okay, I have a question about my report. I'm going to reach back out to MiHIN. Oh, I need an example of what I'm not meeting with the compliance. Okay, I'm going to look up an example. All of those pieces are now in this self-automation, self-service way where you can log on to the website, you can look at your reports at any time you want, and you can start drilling down on the data. And our hope is that, as you kind of get more comfortable in the area, looking at those reports and downloading your examples, you're able to kind of do it in a self-service convenient manner, and then we can get into the more high complex data quality issues that you can start correcting your data from a broader spectrum instead of doing kind of like these one-off examples that you might have been looking in. And it's going to speed up how we're fixing the data in more real time, so it is affecting that patient care, right away instead of maybe days, weeks, months down the road. But the real goal of this was to improve the way that the conformance is reported, decrease the amount of time it takes for an organization to not only recognize what's being sent as non-conformant, but to have the ability for that quicker turnaround time so they know what you need to do to make the data compliant. So the conformance report is really, it's a big aggregation of all these various fields and segments within the messages in general. And it's the overall conformance score. It doesn't contain protected health information. It's just a big aggregation, report and score. And then there's another section of it, which I'll get into, which you can view and download live production messages that are in question for ADTs and CCDAs that do contain protected health information, and we refer to those as fallout examples. And so hence the name Fallout Report when we're looking at those. Next slide, please. So when we're talking about improving the conformance score, there's really, for ADT conformance, there's really three key components that it really breaks down into. It's the complete routing of the messages, the mapping of the data, and then, excuse me, adherence to the coding standards. So is it coded correctly? For CCDA conformance, even though it's this big architecture, document, it's really the routing of all the fields in the CCDA right now. It's just getting those CCDs to go back and forth. And then I think eventually down the road, we'll start drilling down into more of those fields. And I think more fields will be added to that conformance score. So what's nice right now is you can start looking at your CCDA sent, in general, and see if you're even sending all the fields, whether or not they're included in the conformance scores or not at this point. Next slide, please. So I didn't want to take the time and do a demo because we don't really have time to get into it, but I did take screenshots just to kind of get, I'm not sure how many of you have been in and out of this system yet, but I think it's important to just kind of, just so you have a visual so you can see what I'm talking about. So for the conformance report, so this is the module, and in order to utilize the conformance reporting module, the user must first get a MiGateway account provisioned, and then they have the conformance module activated. And you can work with your account executives to figure out the process. They can help you sign up for it if you haven't already done so. And there's a whole process they do on our end so we can get you hooked up the correct way. So when you log in, this is the ADT side, and there are different categories. So up in the left, up left in the blue, the Conformance Overview for Hospital Report it's a use for organizations or groups that manage multiple facilities. So not everyone that logs in will use that. Some people might use that and the ADT Conformance Report just for hospitals, which is for individual hospitals. Some organizations might log in and just look at the hospital one. It just depends on how your organization is set up on your side. And then we also have in the middle, SNF, skilled nursing facilities, and then all the way to the right, ADT Fallout Report, which is, I'll get into that after we talk about just the Conformance Report in general. So this just gives, excuse me, for in the demo cycle, it's a Blue Star Hospital, so there's not any real data here, but it just gives the custom period, and it says the overall conformance score. So 48.1%, it's in red, not the greatest score. Hopefully yours are not red, but it gives you that quick visual and how are you doing. Okay, next slide, please. So within the conformance, so this particular one, the last one that was just an example of individual hospitals. This one is just conformance overview. So it's an organization that has multiple. You can see it says Super Demo Affiliate Network. So it's a network of organizations. But once you get into the report, you can start looking at these different tabs, and there's different sections. So the first tab is Overall Conformance Report. Then there's 3 sections for Population Report that talk about those 3 things that I mentioned that the ADTs are based on: routing, mapping, and coding. And so those give more of a drill down. Then you get into a mapping report specifically, and then a correct coding report. So those are the various fields. In our user guide, we break each one of these sections down with a description and definition so you can figure out what you're pulling. So if anyone has questions about needing access to the user guide, let us know, because that really walks you through step by step when you're inside the module itself. Okay. Thank you. Okay, so the next slide this is an example of the ADT Conformance Fallout dashboard. So this is really great because it's no longer a manual retrieval process. It's not you asking MiHIN, hey, can you send me an example? This is you being able to log in and actually looking at live ADTs. It uses filters to find messages within the last 30 days, and you can pull up to 25 examples. You cannot pull, right now, the way we have it built is you cannot pull all things non-conformant or conformant, however you filter it out, because we wanted you to have the ability to kind of keep moving in real time. So you're not doing these huge historical pullbacks, but you're really, if you're maintaining and keeping up with it, you don't need to look back 6 months down the road. So for this example, in the drop down in the middle, it says find conformant messages. You can also click find non-conformant messages, because that's probably what you're going to be looking for. But in this example, you might want to look at something. Hey, what am I actually doing well? Why is what's the difference? I want to look at one that looks good to see what doesn't look good in the other one. And I know for me, sometimes that's easier to look at what am I doing right first and then go backwards. So I think it's a nice feature to have, to be able to go back and forth. And then this gives you, okay, these are the messages that are conformant. And then where it says message retriever URL, got that long, it starts with the S3, you copy and paste it and drop it in that file path box below, and then you can actually download the information. And it has to be a download feature because it does have private, health information on a patient. And so we want to make sure that we are as secure as possible when you're looking at those examples. So that way the person that's using it can look at just that specific patient data. Next slide, please. So this is a screenshot of the MedRec or CCDA conformance report. It doesn't show everything because you have to scroll through it and see it, but I just kind of wanted to give this. I think it gives a good visual of what you're not meeting. If you're not meeting the percentage, it pops in red. You got 100%, it's in green. It breaks it all down, which is really great. And it's got all these different tabs. There's so many different ways you can kind of filter and play around with it. And that's really what we want everyone to do. We want the users to get in there and start gathering feedback and sending it to us. Talk to your account executives, get that feedback to us, because we're taking it all in and we're building it out so we can make those enhancements to the module as you guys continue to use this down the road. And in our user guide, I'll mention the user guide again, because I didn't want to put it here, there's a list of the XPaths that are used in the XML document for the sections of the CCDAs. So you can break it down that way if you want to look at it back. If you've got the technical person looking at these reports, they might need to see more specifics of what is going into each field. They might just, the score might not be as meaningful to that person, but you also might have someone on the user side, the clinical side or the business side looking at these scores. You want them to be able to see it from this component too. So the CCDA one is it's just got the conformance and it's got the fallout. So those are the two components in the module itself. Next slide, please. Here's the fallout report. Same idea as the copy and paste, where it says file ID next to Blue Star Hospital, and it is field conformant. So got a 1 green, so it's 100% conformant. But down here where we have a 0 and it's red, you can take that file ID, copy and paste it. You can't see it on the screen, but it's the same thing as the ADT. You copy and paste that file ID, then you can download that CCDA to look at what's not conformant. There's multiple fields again that you can filter by for the hospitals when you're looking at these. Next slide, please. The future of the conformance module. I really think that this is a beginning, stepping stone for multiple directions that we are able to grow and expand this. I think that right now we've created these automated reports in the self-service fashion. That's great, but let's get into it and start gathering feedback right away, because I think that the sky's the limit with this kind of module. I think that we can take that feedback, plan it for future enhancements, start looking at other conformance down the road, lab conformance, look at any message type that we send. We can start looking at to see if the data is at the highest quality, and we can build reports around what you're sending and continue to evolve this module and add reports in there, make adjustments, make enhancements. And the more we hear from you on what works, what's not working, not just from the user perspective of the website, because we do want to know, we want that feedback too. You don't want to have to click too many times here or scroll too many times here. We've already gotten some feedback on some of the functionality of the website, which we want that as well. But just the value of the conformance reports themselves. Are you getting what you need from them? What do we need to change? Are you getting notifications you need? Is it helping you on your end to improve things? And if it is, that's great. Let's continue to move forward. And if it's not, let's look at where the gaps are. Because I think it's only going to help us improve the data that you're sending, which is going to help us improve the data that we're sending on your behalf. And so that's really the future direction of the conformance module that I see down the road for MiHIN and for all of you stakeholders. I will stop there for questions or comments, feedback, all the above.
Thank you for that presentation, Crystal. Really exciting stuff, and looking forward to seeing how it progresses over time. As a reminder, you're free to drop any questions that you have into the chat box. Crystal may be responding to those directly as they come in and we go throughout the next presentation. We'll also have some Q&A time toward the end of the session as well. if you don't have a chance to drop those into chat, or think of any others along the way.
So, quick one, because I just checked it for my login, and I see the module, but it says that the user doesn't have permission uh, or valid permissions for this dashboard. So, how do you activate? Um, and for me, I take care of multiple facilities. So I guess I'm wondering, how do I get each one of those facilities associated with my personal logon?
So to address the first question of not being able to see it, I believe Drew Murray did say something in the chat, which I was actually going to say the same thing. Bo will be in touch with Bo Bernanke will be in touch with you. Is this Dan talking?
Yeah, this is Dan. Yeah.
Yeah, okay. Yeah, he'll be in touch with you about getting yours set up. So I know he can help you with that. And then as far as getting your facilities set up, so we have done it on the back end where we've mapped the facilities with what they were with what you had before in your reports. And so if there's any changes to that, you can let Bo know when, because it'll say on the form, if let Bo know if there's any changes, but it should be exactly what you had before when we were sending you the reports. So the
Okay, yeah,
facilities should
that's what
all
I was
tie.
hoping.
Yep.
I was hoping for that. Great. Thank you.
Yep.
Nice presentation, Crystal. Thank you.
Thank you.
Thank you, Crystal. Thanks, Dan. Again, if there are any questions, please feel free to drop them into the chat. Crystal may be addressing them as we go through the next presentation. Otherwise, any of those that aren't addressed in the chat, we will follow up at Q&A time and go through any remaining questions from there. All right, so next up, we're going to call Mike Taylor to the floor, who's going to talk to us about Dorado Reg. Mike?
Great, thanks. And I think I've only got one slide after this, and you can just go ahead and go to that slide and stay there. So we've got kind of a quick but exciting announcement to make about a kind of sub-product that we call Dorado Reg. And so before I get into it, I want to make sure that stakeholders are aware that in the CMS interoperability and patient access rule that came out about a year ago or a little more, there is a mandate for providers to supply their digital contact information to the National Plan and Provider Enumeration System, or NPES. There was not previously a mandate on the digital contact information, and so that was new. A lot of providers do not know that they are required to supply that information. If you actually are going to NPES directly to give that information, there's a number of things you have to do. But regardless of how it gets to NPES, that digital contact information must be provided. So we at MiHIN partnered with a company called 3-1. And if you're not familiar with 3-1, they're a company that helps people manage their provider populations. And we have a super ultralight, it's not fancy, it is very simple and light, free tool that will allow you to register provider digital contact information. I'm going to keep using that term and I'll define it in just a moment. And that will then get registered both with NPES as well as with MiHIN. So the digital contact information is most often going to be a direct secure messaging address. It does not have to be a direct secure messaging address. There are a couple of different endpoint types that you can define, like a Fire server or some other places that you want. But generally, NPES has provided some guidance about what those types can be, and you have to actually agree that PHI can be sent to this place when you're supplying it. The idea is that it's going to be a directory of endpoints so that somebody can look up somebody else and send them something. And so that's really what the Doretto Reg product is all about. It's just a web form that you can register yourself, supply that digital contact information, and be in compliance with the mandate, and also get that registered with MiHIN at the same time.
Thank you, Mike. That's really exciting because I know that in my time working in this industry, it's sometimes been a challenge to get or come to know those direct addresses for that secure exchange. All right, once again, if anyone has questions for Mike or for Crystal, please continue to put those into the chat. We'll go through a few more slides here and then have some open floor Q&A time for any of those questions that don't get answers in the chat. Want to take a minute to just call out our senior regional account executives. We've got Stephanie Miller, who covers that orange territory you see there on the map. Brian Bullock, who is covering the green section toward the middle there, and Greg Kavanaugh in the purple section of the map. So if you have any questions or need to reach out, please consider your regional account executives your first point of contact so that they can help you get the answers that you may be looking for. Their contact information is listed there, and we will be posting this deck at the end of the presentation on our website as usual. So if you don't have a chance to jot those points of contact down, just feel free to check the website, or always feel free to reach out to me as well. Also wanted to just introduce everybody to the corporate account executives that we have here at MiHIN as well. Kim Batchelder, who services the state of Michigan. Katie Olds, serving Michigan Medicine. Bo Bernacki, serving Blue Cross Blue Shield. Megan Gibbs, serving Ascension, McLaren, Munson, and Trinity. And Matt Stromer, serving Medicaid health plans. And their contact information is listed there if you need. All right, a handful of announcements today. Remember to look out for this month's edition of the interface. You can find that at mihin.org/the-interface. The next edition of the download will occur on July 13th at 11 a.m. Typically would be that first week of the month, but with the holiday, we're going to be a week behind schedule with that. Also wanted to just let the group know, for those of you who are not aware, we are continuing to do our legal outreach to legacy GLHC customers. So if you receive emails from us or have questions, just know that we're working through that legacy outreach process yet still. If you do have questions or are unsure of what your next steps need to be, always feel free to drop a ticket into our support desk by emailing help@mihin.org. The imaging workshop series concluded on May 25th. A huge thank you to everyone who participated and spent time attending that series and providing all of your valued feedback. Really appreciated working with all of you throughout that series, and we will be wrapping up that white paper here shortly and getting that final version ready to go, collecting any of those last minute comments that folks might have. Also wanted to announce Connecting Michigan for Health and More. Next workshop will be on June 24th from 9 a.m. to 1 p.m. So you can always check out our website on our events page for more info on that. And last but not least, wanted to give everyone the heads up to be on the lookout in your inbox for a pre-recorded webinar regarding patient access that will go to any of the download participants. And I believe it's supposed to go out within the next day or two. So just be on the lookout for that. Okay, at this time, I want to take a pause, check in with Katie, see how questions are going, see some activity in the chat. Are there any questions that anyone has, or any questions that might not have received a response in chat as of yet? Katie?
Thanks, Tracy. It actually looks like Mike and Crystal have been doing a really great job answering all of the questions. So it looks like Mike is actually in the middle of answering Dan's question. So that was the last one that needed an answer. So it looks like he is just typing that one out. I'm not sure, Mike, if it's easier to say it out loud or type it. But the question was, can we register a clinic direct address on the provider behalf? And it looks like there's 2 points to that answer that Mike's typing out right now.
Sure, I can, I'm only like a quarter of the way done typing, so maybe it is faster to say it. So first of all, a digital contact information can be provided for an organization and not just for a provider, but the actual compliance needs to be at the provider level. I guess it's a three-part answer, because I think maybe what you're getting at is, can an organization address be listed for an individual provider? And as far as I'm aware, which I can get back to you, I'm not aware of any requirement that says it can't be one for the practice. It just has to be listed at the provider level. So if there's 3 providers that all had the same direct address, I'm not aware of anything that says you can't do that.
That's exactly what I wanted to know, because most of our providers have a process for how they accept their information, and they want to make sure that it gets addressed immediately. So they do have a practice level that they want it to be dealt with at, and they want to be associated with that as well. So thank you. Appreciate that, Michael.
Thank you, Dan. Thank you, Mike and Crystal, for addressing those questions that are coming in through the chat. We do note any of those that we might not have gotten to, and we will follow up after the presentation with any that are not addressed. I don't see any other questions coming in through the chat, but again, feel free to unmute yourself or drop your questions into the chat if you have anything further. Some really good content today too, so thank you to our presenters for giving us all of that good information. All right, so the next session again for the download will occur on July, oops, that's a typo, July 13th. I will update that before we post it out to the website. If you have any questions about anything in the presentation today, or you need any assistance of any kind, always feel free to reach out to me. You see my email address there. You can also reach out to our help desk at help@mihin.org as well. Keep an eye on the events page on our website. Lots of things going on, and lots of things coming down the pipeline as far as events go as well. So keep an eye on that, and we will of course send out any email notifications as needed to keep you attuned to all of those items as well. I hope everyone has a great day and is enjoying getting back after an extended weekend. Thanks all for attending, and we will see you next time.